Good afternoon, New Mexico, and thank you for joining us. Dr. Grace, thank you. It's been quite a while since we've done a COVID update together, but as most New Mexicans know, we do COVID updates and make them available, and Dr. Grace has been leading those for well more than 18 months, and New Mexico thanks you. I thank you. It is valuable and important information so that we can continue to make decisions that keep New Mexico safe. I'm going to start the way that we always have when I've been included in the COVID updates. So we're going to go to the first slide, and that is our current case count. All right, so we can see that the COVID situation in New Mexico is, I've got my hospitalization slide up.
That's it.
And it's not the right slide. Okay. I don't know what's happening, guys. Whoever's doing the slides needs to go back one slide.
That's the first slide, Governor.
All right. So I apologize to everyone. See, we have these glitches and that's something we're gonna have to keep working on. So the current hospitalizations 2 weeks ago in New Mexico, we had 180 COVID hospitalizations. Remember, that's not all the hospitalizations. Those are just COVID patients. 1 week ago, that number jumped to 250. Hospitalizations yesterday jumped dramatically again to 304. And you can see that today we have a total of 341 hospitalizations. Unfortunately, also today, we have 4 new COVID deaths, and we have 749 cases. Before we go to the next slide, I want to point out what everybody already knows, because we are following the number of cases and infections in the state, that this is largely driven, if not entirely driven, by an unvaccinated population, that the entire country is seeing these surges, and that the 2 large parameters that we must always address are saving lives, protecting New Mexicans, particularly today, protecting children who are not yet eligible for the vaccine. But we also must protect our hospitals and our fragile healthcare system, which is why we're going to be making a series of announcements today. All right, next slide. So this is a familiar territory. What we must do is enact policies that reduce the rate of infection, lower the positivity rates, they blunt the transmittal rates, right? These surges in infections. We need to do that in its tracks right now. We know that the pandemic is not over and that we're in a pivotal moment in the state. So in our top priorities are always saving lives, protecting our hospitals, but we can't continue our economic recovery and our positive economic journey if we have out of control COVID cases in the state of New Mexico. So what 2 tools do we have available to us today? One is going to be incredibly familiar, and the other one we need to do a better job at. Masks are still one of the most effective and prudent ways to limit or prevent the transmission of COVID, and in particular right now, managing the Delta variant, which is much more contagious and therefore is spreading faster among our unvaccinated populations in the state. And vaccines. I mean, vaccines are absolutely the only way that we can continue to conquer. Conquering COVID was a phrase that we talked about the last time I was talking to New Mexicans directly about COVID. And the only way that we successfully do that is by increasing the number of individuals vaccinated in New Mexico, and quite frankly, around the country. And we're going to do both. We're going to use masks and vaccines to blunt the spread of COVID and see if we can't rebalance where we are as a state, particularly given the Delta variant. Next slide. So for masks, we now are reinstating an indoor mask requirement for any indoor activity. Outdoors, not required. It doesn't matter indoors, whether you're vaccinated or not. It's a universal policy because we now know that vaccinated individuals can spread Delta. While that is, the data is showing us that that continues to be a lower risk environment, it is not zero risk. And we know that indoors, that virus can spread faster because it's not moving or blowing away. So we are reinstating an indoor mask requirement. And if I wasn't speaking in this press conference, I would have a mask on. And I know that many of you have kept wearing masks, have voluntarily worn masks indoors. And I know businesses have required masks without a mandate. I thank you for doing that. I appreciate your leadership and just following as many safety protocols to enhance where New Mexico is. But now we're going to require it for everyone. It will also assist us with an unvaccinated population that is visiting New Mexico. In fact, they'll be required to wear masks indoors. And I want to give you a sense about, we know that folks are going to have to get ready, particularly with employees. So this mask mandate will take effect Friday, August 20th, and it will stay in effect through at least September 15th. It applies to everyone 2 years of age and up following the CDC guidelines for mask wearing. It also includes all indoor school settings, and that aligns with the latest CDC guidance. You might remember that we did a hybrid CDC guidance, and particularly now with the surge, we need a universal indoor mask mandate. And of course, the exceptions to that are eating and drinking, because you can't do that in a restaurant with a mask on, or can't have lunch at your work setting with a mask on, but you need to stay socially distant, and you need to really be acutely aware of the safety of your surroundings. Viral spread is filling New Mexico hospitals, hospital beds, and masks, of course, are going to help us stop that spread. Next slide. Right now, vaccine requirements are now for all hospital and congregate care workers. We are requiring for all hospital workers and all workers in congregate care settings to be vaccinated. So hospital workers, that means all personnel working in any public, for-profit, or nonprofit hospital. Congregate care settings, that includes nursing homes, assisted living, adult daycares, hospice, rehab, state correctional facilities, juvenile justice facilities, and residential treatment centers or community homes. Here you can see the issue is protecting folks who are required to be together or live together or be treated in an indoor congregate high-risk setting. We're requiring that all personnel be vaccinated in those environments. Unvaccinated workers in these facilities must obtain your first COVID shot within 10 days and second shot, if it's needed, if it's not the one dose vaccine, within 40 days of that first shot. That time frame allows for individuals to meet the requirements for each of the manufacturers, so Pfizer and Moderna, so that their 2-week and 3-week second dose requirements are met, and you are safeguarded in your employment through the fully vaccinated status once you've received both doses for the vaccines that require 2 doses. And of course, for workers who qualify for any of the narrow exemptions, those will still be in place, a religious or a medical exemption. A negative COVID test still has to be provided by you weekly in lieu of proof of vaccination. Again, vaccines are the most effective tool to deal with the spread and protection of COVID and the Delta variant. And we must do everything we can to bolster our vaccine success in the state and continue to get to as many unvaccinated New Mexicans as we can. Next slide. We are changing the vaccine policy for school personnel. All school personnel, all workers at public, private, and charter schools must demonstrate proof of vaccination or a proof of a weekly COVID-19 test. That's effective Monday, August 23rd. It's identical to the policy for state government workers. Masks and vaccines keep students and educators safe. Safe in-person learning is the gold standard. We're going to do everything in our power to ensure that we have a safe in-person school year, even with our efforts to stop the spread of COVID-19. All right, now I can't remember. Do I have another slide? I do want to thank so many New Mexicans who have done everything in their power to protect themselves, their family, their friends, and their coworkers. You've been socially distancing. You have stayed home when staying home was one of the only tools available to any state. You did that. You have kept wearing your masks. You got vaccinated. You are doing all of that work. And I will tell you that our hospital workers and so many other at-risk populations, we thank you for your leadership. But for everyone else, for whatever reason, have waited, have believed that there were enough people vaccinated, that doing your part wouldn't make a difference, it absolutely does. And this surge is a terrifying indicator of moving absolutely in the wrong direction. And hospital systems around the country are failing. And what does that mean? It means there are not enough workers, there are not enough beds, there are not enough services to not only treat COVID patients, but to save the lives of other patients who might need care for an auto accident or acute appendicitis or a heart attack, or for all those moms who are going to be giving birth between now and the end of the year. We have to have safe, quality hospital care available for all of those patients. Getting vaccinated is the key to a thriving and healthy New Mexico. You can schedule your shot. As you all know, we have cash incentives, $100. If you go to vaccinenm.org right now, we will direct you and help navigate to the nearest, really easy, accessible vaccination site. Please respectfully communicate with your families and your friends and your coworkers. Educate individuals. Being vaccine resistant does not make you someone that we're trying to fight with. We want to do everything in our power to show you that vaccines are safe and effective. It's been years in the making, and it is the opportunity for us to combat this deadly virus and to make sure that all of us are as safe as we can be in this global pandemic. But we can treat each other with dignity and respect and kindness, and the state will do its part by making sure that where we have high-risk environments, we can do vaccine mandates. I want you to keep remembering that your actions help protect the safety and livelihood of so many of your families and your friends. And again, to all of these healthcare workers who for nearly 2 years haven't had a day off, continue to be besieged by patient care, they need our support to make sure that we are minimizing the number of COVID infections that are finding their way into hospital care. We must do everything in our power to blunt the transmission of COVID-19 and the Delta variant in our state. And I unequivocally believe that these two actions will go a long way towards doing just that. Thank you very much. Thank you for tuning in. And I believe now it's my turn to turn it over to Dr. Scrace. Dr. Scrace, thank you always for your work leading the state and working with the modeling team and the medical advisory team and engaging in making sure that New Mexico continues to be an effective leader, but also does everything we can to minimize what we're seeing, which is impossible spread of COVID-19 in the state. So to you, Dr. Scrace.
Thank you very much, Governor. As you know, it's an honor to serve, and it's been an honor to work more closely hand in hand with folks at the Department of Health over the past few weeks since moving over there for half my time. We're doing well as a state in general with vaccination rates, still in the top 10. Sometime late this afternoon or early tomorrow, I think we're going to break that 75% barrier of New Mexicans who've had at least one shot. You can see we're doing well with younger people, 12 to 17, 55%. Fully vaccinated New Mexicans, maybe next week we will get to 2/3 of all of us at 66.7%, and still working with 12 to 17. I know that now that children are going back to school, parents are more interested than ever in seeing their kids vaccinated to protect them in school. And so we have seen the highest growth in vaccines week over week in that younger group of people. We still have 11 counties that are 50% or less vaccinated. A few counties, actually 40% or less still. And this makes a really big difference. For example, in today's case report, we've got a county in southeastern New Mexico where if you're there, you're 28 times more likely to be infected than you are in a comparative county in the Northwest, McKinley, where in McKinley, they've had an awful lot of cases. They have an extremely high vaccination rate in McKinley County. It's up there in the 80%, 80.6% as of yesterday. And so we really are clearly seeing vaccines making the biggest difference. I think you all remember a couple of months ago, I started talking about the two pandemics and the fact that we were going to have a really significant pandemic amongst the unvaccinated. We are there now. And I think some of the information I'm going to show you about hospitals, I think will be disturbing, and it indicates why these measures are absolutely necessary. Next slide, please. The third COVID vaccine booster dose, people are asking, how come kids are not allowed to get the, 5 to 11, they can't get a shot, but now people with immune disorders can get a third shot? Well, we have research and data on that group of people with transplants and immune disorders that shows that third shot really boosts their immunity. That group was not getting a very good immune response with 2 vaccines. So researchers gave a third vaccine and saw a significant increase, not quite 2, but close to what the rest of us with normal immune systems might get. And just a reminder that for this third shot, that's not part of our $100 incentive program. I wanted to make sure you were aware of that. I saw 3 patients in my office yesterday who asked about this shot, and one of them was actually eligible. 2 or not. There's a lot of us out there who wouldn't mind just getting an extra booster shot in case it might help. But right now it's for a specific group of people. And on the next slide, I'm not going to go through this. I promise the various categories are outlined. Next slide, please. And so people on chemo, people with transplants, and people with known immune diseases, particularly those on powerful medication, for those are the ones who are qualified. And this time we're really asking you to get these vaccines from your primary care doctor, your oncologist, your rheumatologist, whoever's treating you, call. As I mentioned, I had that discussion 3 times just yesterday, seeing patients. And I think they have your medical records. They can look over your medication list. They can tell you. Pharmacists may also be able to do that. But we are really urging those with immune deficiencies, organ transplants, active chemotherapy to really get out there and get that third shot, because it will boost your immune response and provide additional protection from Delta. Next slide, please. Just again, we're seeing this as a CDC study. And actually, New Mexico is part of the ongoing CDC study that really shows that while we're starting to see cases in vaccinated individuals, and that's that little blue bar over on the left, the green bar is cases in unvaccinated people over on the left, you're still 8 times more likely to have COVID cultured out of your nose and to spread it to others if you're unvaccinated. Hospitalizations 25 times more likely still if unvaccinated to be in the hospital, and deaths 25 times more likely than those who have been vaccinated. So we're participating in that study. We're sending our data to the CDC with 11 other states, and we're getting better and better data and analyzing it every week. Next slide, please. I showed this last time. I don't want to spend a lot of time on it. The point is those green bars all the way over to the left. And basically what it says is every single case in New Mexico basically now is Delta. And I'm going to talk about Delta in a minute, but even further, but we've really seen it take over in a way no other variant has. If you look at the orange bar, when it's the tallest there in, let's see, middle of May, there's still other variants present, but Delta has actually taken over and pushed aside those other variants. The best way to resist Delta infection, of course, is being vaccinated. On the next slide, other facts include the fact, next slide, please, that it's highly contagious, may infect up to 4 times as many people now. Some new research is showing, may cause more severe illness. We've not seen that in the United States yet, but they've seen it in Ontario, Canada, and in Scotland. And really, the unvaccinated people are our biggest concern. And again, the vaccine is what we need, what we all need to prevent infection. Next slide. The epidemiologic curves, a couple of things I wanted to highlight. One is that if you look over to the right in that red box there, that top blue line is the very significant upsloping growth in cases we're seeing right now. And it sure looks a lot to me like the upsloping blue line in the other box when we had our big surge that began in late September and continued all the way through to the end of January. And so we are very concerned. We're in that mode now. If you look below, there are 5 other regions. And what you can see distinctly now is the southeastern part of New Mexico is actually seeing more positive cases per day than even the central region that includes Albuquerque. And as I mentioned before, that we're seeing much, much higher case rates in counties where there are lower vaccination rates. Next slide shows that this is hospitalizations, new admissions in the United States as published by the CDC for the first 2, the first 2 weeks of August over here on the right, and look at that upslope. And we're seeing something somewhat similar here in New Mexico, which I think we can show you on the next slide, please. I'm sorry, this is actually US admissions of patients 0 to 17. And so we're now seeing higher new admission rates in young people than we did before. So it appears that Delta is inducing more hospitalizations just based on US data, not by locality. Next slide, please, shows hospitalization rates in New Mexico. One thing that's a little comforting is that slope of that line is a little more shallow. It's not as straight up as the US slope. It's a little bit more shallow, but we are seeing significant problems with hospitals filling and problems transferring people from hospital to hospital and moving people to higher levels of care when needed already. This last weekend, we weren't able to move people who needed to be moved. Next slide will show you. You know, you may remember, and this is a little bit complicated, but we have sort of 3 levels of care. Contingency level 1 is where hospitals are extending themselves, but doing basically okay. Contingency level 2 is when they're having to move and open new beds and close down services and convert even outpatient areas to inpatient areas and cancel elective surgeries. and then crisis standards of care, where we actually don't have enough resources to successfully treat everyone and have to make decisions. And you can see going all the way back to November when we started counting, we quickly went up into crisis standards, came down. We stopped measuring it because case counts came down. But you can see the slope there that we are headed toward crisis standards of care again in hospitals in 2 to 4 weeks. And the governor mentioned this, that if your hospital is full and you have a heart attack or a stroke or a broken leg that needs to be hospitalized, or you need an emergency surgery, there may not be room. And so we're very, very concerned about this and are now watching this weekly and meeting with our hospital leaders every day. ICU capacity in Albuquerque is already filled to the contingency level. Presbyterian, I believe, has filled all their contingency level 2 beds. University and of New Mexico and Loveland, 25% or so of contingency level 2. So we are well on our way up. And the growth of the Delta virus, as suddenly as it's been, is what's driving this. And it is almost all in unvaccinated people. I talked to one of my friends, intensive care unit specialist, who was on over the weekend. She said she had 15 patients in her ICU. 10 of them were COVID patients. 9 of them were unvaccinated individuals. She told a story about a young man with a wife and small children who had not been vaccinated, came in, got progressively worse, was transferred from his outlying hospital to an Albuquerque hospital. Multiple treatments were provided, and he coded, had a cardiac arrest, died, and his wife just so distraught and saying, why did this happen? Why didn't he get a vaccination? And none of us want to leave our family or ourselves have that kind of regret. Next slide, please. Test positivity is up. We talked about this last week. We just updated the graph. It was 9% yesterday. Once we get over between 5 and 7.5% above that, we really are losing track of cases. There are probably more that are out there. You can see we had that same situation in previous peaks, and our old gating target was 7.5. We're above that today. We are seeing an uptick in tests. So thanks for folks who are out there getting tested. We had 10,540 tests yesterday, which is great. We need to stay above that 10,000 level for quite some time in order to stay on top of cases. I think there were 107 testing sites that we know about today. And so just a reminder on the next slide, please, that, virtually there aren't very many good reasons to not get tested anymore. If you're staying at home and you're not having contact with people, you're going to be okay. But anyone with symptoms, whether vaccinated or not, anybody who's living and working in a high-risk congregate setting, well, now you'll be getting tested weekly. And so that will be in place. If you've had close contact with an individual, as some of you know, that happened to me a couple of weeks ago. I got tested 5 days later at the recommended time. And then, of course, there's some routine testing that hospitals do that you could be part of. But please, New Mexico, we all need to get back to getting tested in situations that require it, and don't put it off. So many people these days now in intensive care units and hospital beds that said, well, I thought it was just allergies, or I just had the sniffles, not really sure why. And remember, there's also treatment if you test positive for COVID. Please seek that out, because that can really help New Mexico. The treatments that we have, the monoclonal antibodies, will lower hospitalization rates by 75% amongst those who get them. And that is a really important thing we need to focus on in the next couple of weeks. Most hospital emergency rooms in the state are either giving those treatments now or ramping up, but your primary care clinician can give you advice over the phone about that, or their nurse advice line. Next slide, please. Lots of testing sites, findatestnm.org. You can still do it at home, remember, through Vault, particularly if you're doing a surveillance testing, you can get that test at home and not have to go out to a lab. We're on the home stretch now. The next slide, really, I just want to talk about modeling. I showed these last week, but we're projecting somewhere between 900 to 1,500 cases per day in the first couple of weeks of September, and we are well on our way now to that with over 750 cases today. We also track multiple scenarios, best case, worst case, and something in the middle. We're leaning more toward the worst case scenario. And in the next slide, and this is particularly disturbing to me, is the Lanel modeling that shows that we could have 1,000 cases a day, up to 1,250 per day in the southeast region of the state alone. And we had a lot of attempted transfers and transfers from the southeast into Albuquerque this last weekend, and that's only going to go up. And this peak, when we look at Delta in other countries, lasts about 3 months in general, from when you start going up where we were last week to all the way up and back down again and curving down. It's about a 3-month width, which is going to put us toward a week or so before Thanksgiving. So this is not something that's likely to let up, but masking and additional people being vaccinated, even one shot, there's no question we can start to arrest the spread with both those measures. Next slide. I just wanted to point out that the CDC has a criteria that once you get over 14 cases per 100,000, and that's an epidemiologic term, and you probably can't even read this slide, but what you can see is all but 9 counties in the state, 24 counties, actually are in the red when it comes to CDC case rates. And, you know, we used to have red, yellow, green, turquoise. CDC has red, orange, yellow, blue, and we're not trying to get you to memorize it. The message here is most of the state is completely in the red, and almost all of the rest of it, except 3 counties, are orange today, which would mandate indoor masking as well. Next slide. And also getting a lot of questions about masking in schools, lots of misinformation emails about the dangers of masking. I'll talk about that specifically, but the governor herself asked the modeling team to sort of plot out what will it look like in New Mexico if everybody wears a mask in school, or if just the vaccinated folks go unmasked and the unvaccinated people mask. And the unvaccinated only model, where unvaccinated people don't have to wear masks, produces, let me say that again. The model where vaccinated people don't have to wear masks, that is correct, actually produces 400 more cases a day throughout all of New Mexico, not just in schools, all through New Mexico, than if we let the kids who've been vaccinated not wear masks. And so that's the science here in New Mexico based on the modeling, and where we're starting to see across the United States about having everyone be vaccinated. I did put this slide in from last month. Also, the next slide, please, is on myths and facts for childhood masking. And there are a lot of them out there. There are no reliable studies that show any problems whatsoever in kids. There are some unreliable studies, and even a few that were invented that have now been taken off the internet that people are still sending me that suggest harm for kids from wearing masks. I'm not going to go through this, but just to remind you that there's ample science that shows masks are safe. And in fact, they do reduce the risk of infection substantially. Next slide. So the virus has evolved into a new, more infectious virus that spreads up to 4 times more rapidly to 4 times as many people. Please get tested. Please get treatment if you're positive. And I think everyone should be careful indoors, no matter what county you live in New Mexico at this point. It's a high-risk environment. Washing hands, cleaning surfaces, coughing properly, masking up, and keeping that social distance. Continuing to get healthcare, though, so we don't fall further behind. And then, of course, lastly, get vaccinated. With that, Governor, I'm going to turn it back to you, and I think we plan to take questions. Thank you.
Had trouble getting my mute button off. Thank you, Dr. Grace. And you'd think after 2 years that we have all of these just sort of synchronized so that they could auto correct muting and videoing. But we are now taking questions. Thank you everyone for your patience. One of the reasons I actually really enjoy Dr. Grace's his presentation and the charts, I want New Mexicans like I do to feel incredibly confident about the amount of research and scientific work that is a collective partnership between labs, our universities, the private sector, and the state all coming together and really making sure that not only are they doing the research, but then they're applying it in ways that we all can make productive decisions about the safety of ourselves, and certainly that I can make effective decisions about the safety of the state. So thank you very much, Dr. Grace, and thank you to the modeling team who does incredible work. Nora, we are ready for questions.
Thank you, Governor. Thank you to our media partners that are on with us today. As I'm sure you'll all remember, if you can please raise your hand with a question and I will go through and unmute you. We're going to start with Algernon Damasa with the Las Cruces Sun News.
Thank you, Governor and Dr. Grace. So clearly the main defenses that we're talking about today for the next month at least is masking indoors and vaccines and promoting vaccines. I'm just wondering that based on the trends that we're seeing and what hospitals are bracing for, what it is that makes you confident that these two defenses are sufficient for the next month or two? And what is the basis of that confidence, or are there other defenses that might be reinstituted?
Well, I'm going to go to the back of your question first. I mean, these defenses, particularly masks, we've long seen the science that tells us that it does reduce transmission. And given that we are wanting to continue this blossoming economic, both recovery and opportunity, if we mask, that in and of itself, and they can show you the numbers, just like we did with the schools. If you have the hybrid, it's 400 cases more per day. And if you don't do a hybrid, which is why we're no longer doing a hybrid, I can reduce transmission and reduce cases to less than 400 more a day. So we actually do that math and plot it out. What I know is with this exponential increase, more people that get vaccinated, the less we are transmitting COVID, that these two parallels together should get me to a place. It's already too late, I think, is your point, to tell you that we're not going to be in one of these contingency phases for hospitals to provide services. We're there. And we also know that we're going to continue to climb and that these issues are going to be exacerbated, which is why we're making tough but necessary decisions right now so that that levels out in September and October. And as Dr. Grace said, we begin to see a decline then in November and December. And certainly my hope is that New Mexico can be the most vaccinated place on earth, and we eradicate to the highest degree that you can a deadly virus that on its own will never go away. It's its ability to transmit itself human to human that we can manage and control. I don't foresee that we have to utilize other tools. I think I might take an opportunity, if you don't mind, Algernon, and that is New Mexicans can really think about supporting our economy, supporting their families, going to work. Don't go to work, as Dr. Grace said, if you're sick or you think you've been exposed, don't go anywhere. Get tested. But instead of 10 places a day, remember when I tried to get you to 3, try to go to 5, reduce it by 1. All of these strategies collectively really do have a mathematical sequential impact on reducing the rate of spread. That's why we do them. And I think everyone in the state and everyone across the country is working on the most effective strategy, which is vaccines. The second most effective strategy, masks, and then looking if you need to do other things. And I know that we have such potential with vaccines and the ability of New Mexico to get them to you effectively and efficiently, that I'm confident that these steps will have the kind of impact we need and that more New Mexicans, without being mandated, if they will get vaccinated, please get vaccinated. We're going to continue on the right trajectory, but make no mistake, we're in a terrible place for healthcare services and for protecting our healthcare workers. And too many New Mexicans, again, are going to lose their lives or have long-term chronic illnesses because of the rate of spread of COVID.
Yeah, and Algernon, I think it's a great question. And I would also just add that, like, I don't think we can say for sure that these two things will be sufficient. I do want to throw in there, number one, that people really need to get treatment. If you're over 65 and turn COVID positive, if you have obesity and you turn positive, or if you have a risk factor for more serious illness from COVID, it's a long list. I won't go through it all, but high blood pressure, heart disease, et cetera, et cetera. And so getting that treatment is part of the hope for the future. If we could reduce the number of people going in the hospital by 75% from what it's going to be, I think that combination with masks and vaccines will help. And then lastly, just in general, when we see higher case counts, it's just more common for people that people in their own family who have COVID, and people start to get more careful. So part of that flattening of the curve is the public reaction to all of this. But I am just very, very concerned about what's going to happen in hospitals in the next 3 to 4 weeks, and so are all the people who run them. Thank you.
And I might add one more thing that I think we have forgotten, but I remind localities and others all the time, and sometimes even vaccinated folks who say I've done everything right. We run out of nursing home workers and staff in all of our long-term care and correctionals and congregate facilities. And we were short staffed in New Mexico, which we've all talked about for a number of reasons, but it doesn't change the fact that without COVID, we struggle to have enough healthcare personnel to support us and to treat us, particularly with New Mexico's underlying conditions. We have a common respiratory illness among pediatric populations and infants, RSV, and we're seeing a huge uptick in the number of those cases that require hospitalization. We just know we have risks in this state that require that we can respond. We believe that with the treatment, thank you, Dr. Grace, masks and vaccines, that these three things will do enough. I wish it was enough to eradicate COVID. It isn't enough to eradicate COVID, but it puts us on a path, I think, where we can continue to go to work, support our families, and to do the work that we worked really hard to get to. Let's keep doing that. And we are as confident as you can be in the situation we currently are in about the decisions that we have now made.
Thank you, Governor and Dr. Grace. Next, we'll go to Dan Boyd with the Albuquerque Journal. Dan, go right ahead. Dan, if you want to go ahead and unmute and then go right ahead. There you go. Go right ahead.
All right. Can you hear me now?
Yes.
Yes.
Okay. Thanks. Thanks as always for your time and the opportunity. On the subject of hospitalizations, I wanted to ask, it's my understanding that at least until recently, the bulk of patients were not COVID patients, at least in a lot of hospitals around the state. Given that context, has there been talk of, again, kind of pausing the elective surgeries and procedures to ensure there is enough space? That would be my first question. The second question is, given the new vaccine requirements for school workers, has there been any additional discussion or thought about a vaccine requirement for students who are eligible to get the vaccine?
I'm going to do the second part of that question and then throw it to Dr. Grace. We have not had the modeling team or specific conversations about mandates for kids. In fact, I'm unaware of any state doing that. It is a really tough issue for us to get in front of parents on that issue. But as you know, states do have mandatory vaccines, childhood immunizations that are required to go to school. I think it's going to be a journey to see where the CDC and others work with states to find the opportunities here. I'm still hopeful. We still get a fair number of, parents and families, and particularly those with kids who are not in the eligible group, who are really desperate to get access when made available, because the data indicates that it's ready and safe for 5 to 11 to get that vaccine available. So we're going to continue to make sure it's accessible. We're going to provide education, but that has not been in front of the modeling team. And I don't think it's been in front of our national folks quite yet, but I know those conversations are occurring. Two, I can tell you that hospitals voluntarily are already doing limiting, right, and postponing non-life-threatening procedures or in-hospital services. And I don't know that we'll have to put that in a public health order. We're prepared to do that. But the Hospital Association and others, to their credit, have been following our protocols that we engaged in when we saw positivity rates this high and case numbers this high on their own. I will tell you that everyone is really frustrated that we continue to not be able to take a patient into an ICU bed or patients into Albuquerque. We still have fully operationalized, our regional transfer. We want to make sure the right care at the right place, that all patients get as much as we have to offer. That's our commitment as a state. But the number of cases is making that incredibly challenging. And many of our rural hospitals without sufficient staff are navigating, waiting for beds to frankly open up for a number of issues, not just COVID. But you're going to see COVID start to displace any opportunity for anybody else to be in the hospital, which is, of course, our concern. And I'm sure Dr. Grace has more specific information on those electives and any of our crisis standards. Thank you, Dr. Grace.
Yeah, thank you, Governor. Great question, Dan. I think that, remember, we closed all elective operations in March of 2020, and then they reopened, and then we did not do that during October, November, December. Hospitals responded sequentially, fairly dramatically. And I know that people are already moving any case that can be done in an ambulatory environment there. Spaces are being converted to additional ICU spaces. We have one hospital that's running at 150% capacity. But I think the main thing to remember is, in the past, when we were thinking about this, we were thinking about people coming in for an elective surgery, maybe just to get their knee replaced or something like that. Now the problem in hospitals, and they're still full with the majority of people who are not COVID patients yet, it's really, really sick people, in large part related to delayed care. Coronary artery disease, heart disease going untended for a year or two, or diabetes or other conditions. And so the level of illness and burden of illness was much higher before Delta broke loose than it was, a year and a half ago before the pandemic started, because of this delayed care catch up.
And I know that I will get other questions in the queue. The other issue that I place in the hands of the modeling team and Dr. Grace, and then I participate in weekly calls with the Biden administration, CDC, sometimes representatives of the FDA, although they give us updates about their data collection, right? There's no interface between requesting information. The FDA is an independent body that comes to independent decisions based on data and the data criteria presented to them. But what we still know is that while kids can spread and certainly can get COVID, and there are kids in New Mexico that have had COVID or unfortunately will get COVID, and we know that they're not super spreaders. We know that that while the risk currently still appears to be lower than most or many adults in terms of significant illness, that data is still coming in, and it's still coming in about Delta. We do have a lot of kiddos with underlying conditions in the state, right? We have one of the highest asthma rates per capita, as an example. So I just want to be really careful that these decisions, we don't come to lightly. We have to have data. But while these conversations are happening, a lot more information needs to be available before I think you'll have even pediatricians and others weighing in about adding that to a vaccine regimen for school attendance in this country in the near future. I think they're continuing to really look at these issues, and they should. And that's my expectation for my own modeling team, as well as the national team and our national experts on kids' health.
Thank you, Governor and Secretary. Next, we will go to Matt Grubbs with New Mexico PBS. Matt, go right ahead.
Thanks, Nora. A couple of questions. Have you given any thought to going back to the county by county system or to a vaccine passport? And the second question is, a number of Republicans over the past couple of weeks have raised concerns about the migrant population crossing the border without any sort of medical screening. Can you address that, please? Thank you.
Well, I'll do the second one first. I have a habit of doing that. It's on my brain first, I suppose. We've certainly weighed in with the Department of Homeland Security. I've had personal conversations with Secretary Mayorkas, and while I disagree with the categorization that the spread of COVID is at the border, and we can see that COVID is everywhere, that's not what it is. That doesn't mean that we shouldn't enhance our screening protocols. We should do it everywhere. And I've been really clear that for ICE facilities, detention facilities, for crossings, for screenings with all the BINACs now and rapid tests and the environment, that the federal government needs to do a better job at the Canadian border, at the Mexican border, in every context, in airports. We can do a better job, and I think they have an obligation to do that, and they've certainly heard from me on that subject. I disagree that the risk factors to New Mexico are at the border. The risk factors here, too many New Mexicans did not get vaccinated, and too many New Mexicans have refused and failed to wear masks, and too many New Mexicans have engaged in high-risk activities or even knowingly had COVID, maybe had no symptoms, and spread it. That is really the genesis of the problem here. And that is what we're going to continue to combat, which is why we're doing mandatory vaccines in the places where they make the most sense, given the current risk. And we're going to continue to do everything we can in that regard. At this point, we have the variant and so much COVID everywhere that I'm going to assume that Dr. Scrace, in that sort of it spreads beyond COVID, doesn't know where Chaves County or Bernalillo County, not that they're contiguous, but where one ends and begins. That was very useful for us to figure out hotspots and mitigating and related strategies to do access controls, where that was one of our only tools. So I don't see us going back there, but you do see that we use a map to determine what the vaccination rates are and to get a sense about how safe you are in a community. And we use that to translate to what we think the rate of spread is likely to be and what the impact then is on hospitals. So that sort of map, that color coding, the CDC, as you can see, I'm going to say they stole that from us. Dr. Scrace might disagree that that's actually a fact that I can assume and own. But these color coding strategies are effective. I don't see us using it now to determine making key decisions. The key decision is masks for everyone indoors and getting our vaccination rates up and working to blunt that back down to a flat and a reducing caseload situation. Dr. Scrace, am I missing anything?
No, I would just say, Governor, also that we could go back to a red, yellow, green, but within a week or two, New Mexico
Everybody would
will
be
be
red.
red and will stay red for about 10 weeks like we did last time. So it won't really give us much utility in the next, couple months. That's all. Thanks.
Thank you, Governor and Secretary. Next, we'll go to Julia Goldberg with the Santa Fe Reporter.
Thanks, Nora. Thank you, Governor. Thank you, Dr. Scrace. I don't know if Matt's question, which I was going to ask, was answered, which is whether the state is considering any kind of digital certification process. I think 4 states have them and 20 states have banned them, maybe. And the other question I wanted to ask is the weekly report on exposure and activities indicates that travel and gatherings have been highly cited among people who have been tested positive, travel pretty high, gatherings as a rising factor. Governor, I know you just already went through saying these are the masks and the vaccines are the most important, but in the past, travel and gatherings both had sort of specific limitations, and I wondered if that was on the radar as well. Thank you.
Sure, Julia, I didn't answer Matt's question, so thanks for being Matt's advocate and making sure that everything that's asked that we do our very best to get everything answered. You know, I'm certainly in New Mexico not interested in banning anything that helps spread slow the spread or eradicate the spread of COVID. And you know that we unequivocally, if we're willing to mandate vaccines, that we think getting vaccines and having proof of that are key and powerful components. There are lots of now private sector folks, not the least of which Raiders have made it really clear that you have to show proof of vaccination. I'm leading by example by requiring a large gathering event, the state fair, to have proof of vaccination for admittance. So we think that there are ways to apply these standards. I want the state to lead by example. I'm asking for folks to look at these issues, not the same as a vaccine passport, but it really does start to deal with your question, which is if large gatherings are high risk, even if they're outdoors, are we going to do something that mitigates risk? Again, getting more people vaccinated, you get to a state that's got 80% vaccination, you get to state activities that are largely state focused, and then we require out-of-staters to wear masks. We're in a pretty good space. But I think the debate about vaccine passports is an important one. I don't know, I'd call it a passport, but being really clear that venues are safer if vaccinated people are attending those venues and unvaccinated people are not. That is just a fact. And so we haven't made any decisions. I haven't asked the modeling team to tell me what that would do to reduce the rate of spread. And he's trying to figure it out as I say it, how you would figure out. You'd have to go to the percent increase or the percent population traveling here from the key states, Dr. Grace, just so that you know that I actually do engage him. And sometimes he says I'm on the right track for data gathering, and sometimes he bosses me and says I'm not quite getting it right. But that's how we would come to better data about that. So we have not made a decision. We have not debated it with the modeling team and our other experts. But I don't foresee that we would be a state ever that would ban those aspects. And we would really encourage businesses to make those kinds of decisions about their venues, events, and trainings, that it should be vaccinated only.
Thank you, Governor. Next, we will go to Daniel Chacon with the Santa Fe New Mexican. Daniel, go right ahead.
Good afternoon. Can you hear me?
Yes.
Okay, perfect. Thank you. I had some technical difficulties earlier, so please forgive me if you've addressed this question. I have two questions. Public, private, and charter school employees will be required to be vaccinated or be tested weekly. What about public higher education institutions? And the other question that I had is that New Mexico has a high vacancy rate among prison guards. Will prison guards who refuse the vaccine lose their jobs? If so, how will the state fill those positions, which are already so difficult to keep staffed?
Right. Well, let's do, again, I'm doing the same thing. That's my pattern. Go to the last one first. It is possible that people choose to sever their employment because of the vaccine requirement. We hope that's not the case. And in that situation, New Mexico will have to transfer our correctional population to places where we have sufficient staffing. I want to point out that based on an indication from a national conference, which I believe is all virtual, we were told that our New Mexico corrections vaccination rates were highest in the country. So that's remarkable, and we want to make sure they stay there and we get to 100%. But that varies correctional facility to correctional facility, and it tracks, frankly, with the lower vaccination rates of some of our counties. in those particular counties, if that occurs, we might very well have to move our correctional population so that the staffing levels meet the requirements and we create a safe environment for both people who are incarcerated and the individuals who work there. I mean, we have shortages in nurses, shortages in teachers. It is now a national, of epidemic proportions, and we are wary and cognizant of that, but also know we've got to save as many lives as possible, and we have to blunt the spread. So we have definitely thought about that, and think that we have an effective contingency plan if in fact that occurs. And in educators, this shift in the policy is also recognizing that you can be outdoors, that we can do social distancing, that we have limited time inside a classroom, and we are happy to be applying as many of those kinds of standards to higher education. We have a different state relationship about what we can and cannot do, but I will tell you that many of the universities, Western, University of New Mexico, and others, and community colleges are already making decisions about student populations and their faculty and administrative staff requiring vaccinations. I think that you will see a buildup of that after today's announcements, and we applaud those decisions, and we've been working diligently with regents, university presidents, and leaders and their unions to make sure that we do everything we can to bolster vaccines, both in their students and in all of their workers statewide. And we're seeing them do that with, I would say it's more than encouragement, less than a mandate, but as close as you can get given what we're allowed to require universities to do. It's a little bit different than schools where we're engaged in protecting minors. So it's a bit different, but I think you'll see them get to a even more robust place for mandatory vaccines than even our public schools.
Thank you, Governor. Next, we'll go to Chris McKee with KRQE. Chris, go right ahead.
Hey there. Thank you for taking the time to take the question here. I wanted to ask in relation to the health order related to vaccines, if I am reading this correctly, only vaccinated people with proof of vaccination will be allowed on the Expo State Fairgrounds during the state fair, so outlined from the 9th through the 19th. Now, unless they have an exemption and a recent negative test is the way I read it from the order. So with that being said, I did want to ask if perhaps you were working along those same trend lines for New Mexico's biggest outdoor event upcoming in October still, Balloon Fiesta. And what does this implementation look like logistically when you have so many people potentially going in and out of that fairground facility? Thank you.
Well, we are leaning in the Balloon Fiesta board, as we've certainly provided them with how we came to our decisions, how we would implement it. And I'm strongly encouraging others to follow suit. We're hopeful that this decision that we've made about the state fair will encourage other large venues and events that are coming to follow suit in the same way, because we believe that will increase safety and decrease transmission. Airlines, as an example, have incredible easy now apps to show proof of vaccination. We'll require the same thing, that a note for an exemption from either your religious organization or yourself explaining that a religious exemption, or from your physician saying you can't receive a vaccine. We're not going to stop you at the gate while we call those individuals. I suppose some people will not be earnest and do something different. I suppose, given the national and worldwide trends where we've seen individuals cited and not allowed to be on federal transport for fibbing about vaccine status, that we'll have some of that. But I would say, I believe the vast majority of New Mexicans who have an easy card that can get onto an app in terms of a photo that allows you in that photo to make sure that personal identifying information can't be moved so you're protected. We think we can create a pretty readily accessible in-out environment for folks at the state fair. I don't want to suggest that it will be completely perfect. The state fair's coming right up, and it'll be our first large event where we're trying to do that. But if our vaccine success and testing success are any indications about moving people through while having to take registrations and getting information from folks, I think we can do it at Expo too. And I hope to create a model for other large venues. But that's basically what we're thinking. We'll create an app that allows folks to get that readily available and showable, and they can just move right through. And that's what I have so far. And as we get more information, we'll provide it.
Thank you. Oh,
Dr. Scrace?
Just really, really quickly, a reminder that vaxviewNM.org is a place you can go to get your vaccine data and print it off. You could bring it with you to the state fair. That'd be sufficient. If you go on there and your data is not what you think it should be, please call us, because then we can correct that database, update it, and you won't have that trouble in the future. Thank you.
Thank you, Governor and Secretary. Next, we'll go to Nathan O'Neill with KOB. Nathan, if you want to go ahead and unmute.
There we go. Can you hear me?
Yes,
Yes.
go right ahead.
Perfect. I just had a question about hospitalizations. Do we have a sense of how many people are from out of state that are currently hospitalized with COVID in New Mexico? Is it, significant? How would you describe that?
I'm going to go to Dr. Scrace. We do have quite a few. I don't know the exact number. I know that Dr. Scrace does, and we talked about it earlier today. There are also quite a few New Mexicans in Texas hospitals, Arizona hospitals, Colorado hospitals. There's a federal requirement that when we need healthcare, you have to accept patients, whether they present directly to your state or whether we have to find a bed. And we're working through that. And Dr. Scrace, do you have that exact? I know you're looking for it.
Yeah, well, a couple things about that. Number one is this happens every time hospitalizations go up, is rumor spread that we're besieged by people from Texas or Arizona or Colorado. And then we do a special report. We can get pretty real-time data for out-of-state hospitalizations. It was running about 13 at the end of last week. And on your hospitalization report, under the voluminous epidemiology reports now that come out every week on DOH, you can see the updated number today. We had 40 people on the waiting list, I believe, as of this morning for transfers. About 2/3 of those are from out of state. On the other hand, we have a lot of people who are actually New Mexicans in other places. I was just one of my patients who was in yesterday talking about her daughter who's an ICU nurse in Colorado Springs, saying that they've never seen as many people as they have from New Mexico in their ICU there. And so when we check, it's always a net of just about zero. So we don't believe we're seeing a net influx of people from Texas, for example. We know we send a lot of people transfer out of state. We transferred, I think, 55 people out of state also, or 45 people out of state over the past week as well. So it's about even. It's just what's available at the exact moment where somebody needs to make that transfer. And we have those sort of similar exchanges with Arizona and Colorado as well. Thank you.
Thank you, Dr. Scrace.
Thank you, Governor and Dr. Scrace. Next, we'll go to Sean Griswold with the State's Newsroom. Sean, go right ahead.
Hello, can everybody hear me?
Mhm.
Excellent, thank you. So this is actually piggybacking off of the question regarding the state fair and the balloon fiesta. There's a major event happening in Santa Fe, the Santa Fe Indian Market, and it's operated by a non-tribal entity, and so it's a private enterprise, but it's still bringing in thousands of visitors, many of which are already in New Mexico, from other states and other countries. And many of the artists that participate in the Indian Market, their communities have already shifted to stricter protocols. So I'm curious to know, like, is there anything that the state can do to enforce masks, social distancing at Indian Market? And will the state track individuals from out of state that attend the market who contract COVID? And that will help us assist in understanding if the Indian Market becomes a super spreader event that could impact capacity at local hospitals.
So the tracking about a super spreader event is harder, as we talked about, Sean, over the last 18 months. We do contact tracing for every single case. Depending upon what people tell us, it's really hard to say that that is the genesis, although actually it's reporters who often can do that extra layer of investigation. I mean that as a compliment, that has allowed this country in particular to identify large gatherings or a family gathering or a church service, or, as you're indicating, potentially the Indian market is a place where you can demonstrate that your concerns were valid because X occurred after. So we'll do that no matter what. How much information is going to depend on how many cases and where people said they were here for the Indian market. Most of the Indian market is outside, so our mask mandate is not going to apply. But I can say, and we'll call that vendor based on your question, we should encourage all of the artists to wear masks in their outdoor booths and for anything that's indoors or judging. That would be required masks that we have, oversight powers about, because now we've put in a public health order, an indoor mask mandate. So any of those celebrations, any of those judging activities, they have to have masks. And again, out-of-staters have to have masks. Outdoors, we can talk to them about social distancing requirements, best practices. And again, you're correct. Most of our sovereign nations in New Mexico, and in fact, I believe, so Dr. Scrace, correct me if I'm wrong, I believe that New Mexico's collectively sovereign nations have the highest vaccination rates by far of not only any other indigenous populations in the world, but by far, as you look at, our county and statewide vaccine data. We've got tribes at 98% as an example, and pueblos. It is incredible. And they've got many of them. I was at a pueblo today that has a very strict on-off policy, and I was required to show my proof of vaccination, and I was required, without today's mask requirements, to be in a mask. And I wore an N95 indoors throughout my entire presentation. So you're correct. They've really done extra work. I know some vendors are going to participate virtually. So that is what we're going to do. We are not prepared today to upend the Indian market and to try to apply mandates that would be too difficult and too late to apply. But we can talk to that private vendor about best practices and even maybe provide PPE to visitors who are not prepared. And something I'll ask Dr. Scrace to do in preparation, not that I haven't been pressuring him about more testing sites, even though he said we've got well more than 100. Let's see if we can't work with the city of Santa Fe to provide nearby both rapid testing and PCR testing for folks. Do as much as we can to make that the safest environment we can. And I appreciate your pointing out, we've worked really hard to get to a place where New Mexicans and our visitors can participate fully in so many of our both economic successful drivers. Artisans were hit so hard in the last 18 months. Vaccines are the way that we move forward. And yet we have too many visitors who are not vaccinated. That's true. And here's a way that I think we can maybe lean in a little harder and support everyone and ask that vendor to do right by New Mexico and do right by the artisans by keeping them as safe as possible. They could also even require, to get access to some of their areas that you be vaccinated. So let's see if we can't work with them to do the best possible job. You have my commitment based on that question to do more in that regard. You're muted, Dr. Scrace.
One last thing, very quickly, in a super spreader event, the first thing we would see is a sharp uptick in cases in Santa Fe. I mean, because people get sick and not everybody goes home. A lot of Santa Feans and New Mexicans go as well. We had 20 cases today in Santa Fe. And so we would start seeing that double almost immediately. So that gives us sort of the red flag we need to look further. Thank you.
Thank you, Dr. Scrace.
Thank you, Governor and Dr. Scrace. Next, we'll go to Stephanie Muniz with KOAT. Stephanie, go right ahead. Hi, Governor. Thank you for taking my question. This is actually going to be for Dr. Scrace. Our question is, with the vaccination requirement for healthcare workers, do we have a number that that could be provided and shown of how many nurses in our state are vaccinated, or what that percentage looks like?
Yeah, that's a great question. Thanks so much for asking it. It's a different one than the governor asked me last time. It was like, how many healthcare workers out there aren't vaccinated? I said, somewhere around 27,600. And that's based on the number of healthcare workers and about a 80% vaccination rate. In hospitals, the vaccination rates are north of 90% for doctors. Doctors are about 99%. Nurses, self-reported from the hospitals, run around 90%. So it's about 10%. I don't have in front of me the number of actual nurses in the state. I think the licensing board would have that, but we're most of the way there. This just gives the opportunity for healthcare institutions to really make sure that everybody has that chance to be vaccinated, and that patients feel safe. A lot of patients will ask every single person who comes in the room, are you vaccinated? Are you vaccinated? And that's kind of an anxiety I don't think people should have to have when they're hospitalized.
I might also add that across the country, and including in New Mexico, the escalation of anger among employees about what's occurring, and we need to de-escalate that. This has become, and it shouldn't have ever, still way too political, without facts and science being available to even healthcare workers in a way that can, as Dr. Scrace said, you need to be confident about your healthcare. We already have an exhausted healthcare system, exhausted men and women who are caring for us in this during this global pandemic for almost 2 years, and it's going to continue. And this also creates a safe, more positive environment for everyone working there, even though we have some individuals who have yet to get vaccinated, or I have no doubt will be displeased by this decision. But overall, it's nearly 30,000 additions in areas where we need them to be vaccinated, and we need the safest possible place for patients to get care. And those 30,000 people, we will limit their ability to get COVID, to spread COVID. And who knows, maybe it's one of their lives or their family's lives that we save by virtue of these measures.
And I just follow up, I did grab some data off the internet, a nursing licensure in New Mexico. If you add RNs and LPNs and assume that about 90% of them are vaccinated, that would leave 2,781 who are not.
And that doesn't include nurses who work in long-term care facilities, Dr. Scrace, which would be another number. Not a huge number, but
a little lower. Yeah, that's all nurses. So it'd be on, but though you're right, the staff and
DONs. Yep.
Yeah, staff in nursing homes about 75% vaccinated, but much, again, very high in doctors and quite high in nurses. Thank you.
Thank you, Governor and Secretary. Next, we'll go to Susan Montoya Bryan with the AP. Susan, go right ahead.
Good afternoon, Governor and Dr. Scrace. Thanks for taking our calls. 2 questions for you. I know the first time around enforcement was pretty difficult in terms of the masking mandate. Any words there in terms of citations, or if state police are going to be asked to enforce that, or how we might go about that? And the second question is, we've had several schools be forced to go back to virtual due to COVID cases. Any discussions about the criteria for what will trigger them to go back to virtual as opposed to in person, and whether we toughen that up or relax that? Thank you.
Well, Susan, absolutely. The state police will be called upon again to engage in enforcement. And we know that we had to call on a variety of other folks to make sure that we were doing that. Kudos to the New Mexico State Environment Department that did incredible compliance work for masks and other requirements, including, capacity issues that are not part of the public health order. And also agents in a number of other departments and agencies, including game and fish and energy and minerals. So we will continue to use all of that. I hope we're not in a situation where we have folks who are working diligently not to comply. And I know that it is, while many New Mexicans, myself included, have been wearing masks. I did after I was fully vaccinated, and after July, outdoors, enjoyed some outdoor events without a mask, and this is not required, but I really enjoyed that. But I always wore them indoors. I never stopped. I know many New Mexicans never stopped. I saw many New Mexicans wearing them outdoors. I might choose to do that just to increase visibility for mask wearing. So I'm hopeful that we don't have the same debate over compliance. And again, the more New Mexicans that are in this together, the quicker we see, right, the impacts of the decisions that we make. But we will be prepared to enforce, and I'm sure that's going to be as challenging as it was the last time, but we will. And then schools, the 8 schools, which has included a variety, right? Mid schools, high schools, elementary schools. They've made the decision on their own because of COVID cases to go to distance learning. You know, again, we believe that masks and vaccination protocols and mandates will get us to a place where students are as safe as they can be. Educators are as safe as they can be, and we're getting more people vaccinated. We don't want to opt out of the gold standard, which is in-person learning. We want it to be safe, and we're going to keep pushing masks indoors and vaccines. So today we aren't modeling that. We're not going to tell a school they can't close as long as they can meet the distance learning requirements of the state for their populations. But we're encouraging schools to get more people vaccinated, to provide more information with us to parents so they get their kiddos vaccinated who are eligible. And the minute we have a younger population eligible, we'll do everything we can to make it easy for parents and schools to get those kiddos vaccinated and safeguarded. Again, that's the most valuable tool to protect New Mexicans and blunt the spread. So we're going to keep focusing there. I can't predict for you with the rate of spread that we currently are attacking, how many more schools might make those decisions, but we are not forcing them to make those decisions. Testing, surveillance, mask wearing, social distancing, and smaller classroom aspects are all the mechanisms that we think create a safe environment for what we continue to call in-person learning, which is the gold standard.
And just
Dr.
two quick
Grace.
comments, Governor. I don't have much to add. Number one, your number was correct. There are only 8 schools that have closed. Last winter, when we had criteria in place, there were over 100 school closures, and only 2 were actually triggered by the state in discussion with the superintendent. Almost all the others were voluntary. Christine Ross, our state epidemiologist, and I are sort of dividing up the work this week. I'm working with hospitals. She's working with the schools. They are modifying that toolkit and coming up with some guidelines for schools to use that are adapted for the Delta variant. And I'm hoping that work will be coming out this week, maybe near the end of the week or early next week. Thanks. Oh, one more thing. Okay. Just one last thing on enforcement. I know everybody immediately goes to the police, but put up a sign on your business that says, please wear a mask. If you're having folks over to your house, say, hey, COVID's hot right now. Everybody's going to be wearing a mask. Like, there's so much enforcement that could just so easily happen at the local level. We're talking about indoor spaces. Almost all of those have doors. All of those have a place to hang a sign. And so I'd really encourage everyone in New Mexico to deputize themselves as protecting all of us and our communities and our families by asking those folks that we invite indoors, businesses or wherever, to keep their masks on. Thanks.
Although we're going to do that politely, we're not going to escalate any issues. And I appreciate that. And I was going to tease Dr. Scrace for saying he didn't have to correct me on the school closures. Just for everyone who is curious about, when you have so many facts and so much data that you have to manage, and we do it every day. And now Dr. Scrace and I get to do that for 2 departments. He does correct me, and I expect that of my cabinet, because what we want New Mexicans, we want them to have trust and faith in the data that we share. And so thank you, Dr. Scrace, and I'm going to see if I can't end this press conference without making any mistakes.
Okay.
Thank you, Governor and Secretary. We'll have one more question from Jeffrey Plant with the Silver City Daily Press. Jeffrey, go right ahead.
Thanks for taking my question. I wanted to see if you could clarify something in the vaccine public health order. It indicates that workers at state correctional facilities are included in the vaccine mandate. Can you clarify that workers at county detention centers or municipal detention facilities are not included in that mandate? And just a corollary to that, if they're not, are you encouraging local governments to require their employees to become vaccinated?
So they're not required as part of the public health order, because technically, while they're public employees, they are not state employees. And yes, I am encouraging local bodies of government, and we've had conversations with mayors and county commissioners and emergency managers. We hope that they will follow suit and make the same mandates and requirements. As you know, congregate facilities and corrections continue to be areas where we see spread, or areas that we identify as hotspots. And we really struggled with spread in both federal facilities. And I say the very same thing to the Biden administration, that we have high expectations about their ability to blunt spread, and they should mandate it. They're doing more mandates at the federal level. I expect that to be one of them. But yes, we are encouraging every local body of government to follow our lead in vaccine requirements and mandates.
Thank you, Governor. I'll turn it back. Oh, Dr. Scrace, did you have one more thing?
Yeah, I had a follow up on an earlier question, and just wanted to highlight Mike Edwards, who directs our state lab, texted me. Someone asked about the assertion that perhaps the outbreak we're having right now in New Mexico is related to people immigrating across the border. And you know, the family tree that our state lab and Lannel and UNM have put together for the development of the virus and the spread of the virus really fingerprints these different variants. You know, we have multiple Delta variants, and there's really no evidence at all that the case transmission and spread of Delta in the United States is coming from across our southern border. All of the lineages and parents, if you will, of the viral strains we're seeing here in New Mexico actually have come from other places in the United States. So I just wanted to clarify that we can actually track that now, and the evidence does not support that. Thank you.
Well, Dr. Scrace and Dr. Edwards, thank you for that. And again, I worry that some of the national news, which is not really news, is highly politicized, highly inflammatory, and more often than not, completely incorrect. And New Mexico is going to continue to be a science state, and we're going to follow the data and follow the facts. And I want to tell New Mexicans that I do. While I am clearly distraught, we all should be, about what's occurring in New Mexico and across the country, that we are still engaged after all this time in a worldwide pandemic of a deadly, highly contagious virus, that most of us have done everything in our power to blunt it and continue to lead by example. I thank you and your families. There's more to be done, so we will keep doing that in the same way you depended on us to make the tough decisions, but to lean in to make sure that we save lives. We make sure our healthcare system doesn't fall apart, that it's available to you and your family, and that we continue to lead by example by having vaccines in the arms of New Mexicans at much higher rates than the rest of the country, which again protects us from the people in other states that aren't doing everything in their power to be vaccinated. Thank you very much for joining us today, Dr. Grace, as always. Thank you for your leadership and your hard work. And thank you to the press corps and media for making sure that frequently asked questions gets out to New Mexicans in this format. I appreciate you. And let's get this done, New Mexico. Thank you very much for tuning in.